Well, good morning. I have this issue, I believe, in starting on time. So thank you guys for coming, for connecting with CARE, our very first workshop. And I'm so excited because you guys are taking a step to let us provide you with some information and some tools in your commitment, I'll say, and your obligation, possibly. So thank you guys for coming. We're hoping to have monthly workshops to make sure that we provide information, because as Dr. Abbs said, and we talked about so much, there's so many different avenues, so many different things that we can eventually talk about to help you guys on the way. And besides, we want to make sure that you understand that you're not alone if you're taking on this obligation by yourself, okay? So I won't go on too long, but I do want to say I'm so grateful for the people here, and I'll just name them there now, but they'll tell you more about themselves later. I call them my key team. They laugh when I say that. But the reason I call them the key team is because, and this is just 4 of them today, there's a whole team. Elizabeth didn't know it, but she's definitely part of that team too. Tina back there, part of that key team. And it's because they have the knowledge, experience, and education to help us move forward and provide the information that we need to the people to help them with this journey. And I will say the reason this is a passion of mine is because I serve on the Department of Family and Protective Services Council. They talk about child protective services so much. My passion is APS, Adult Protective Services. And I realize that they do a lot of training for parents to get their children back, but they've never did any training for adult children helping with their aging parents. And a lot of people just don't have a clue. And so this is what we're hoping to provide, some tools and resources. And this key team, my goodness, the knowledge that they have, that they're able to provide with the resources and tools is going to be amazing. So Dr. Abbs here, Dr. Nedgra Abbs, she's going to be talking to you and just giving you some great information, getting started on this journey. We also have Tori Hopkins back there. She's a licensed clinical social worker. She works with St. Joseph Hospice. And those 2 great ones back there, we have Ali and Altagracia Naqi. They actually own the place where we are at your side, home care. And so we're grateful to have them. So we're going to get started now with Dr. Abbs.
Good morning. Good morning, everybody. Before we get started, I want to unofficially make you Citizens of the Year. And I say that because you have given up a part of your morning to come here to learn about something that is not talked about a lot. And sometimes when we get into a situation of caring for our older parents or whoever else, we find ourselves at a loss. I am, like they say, I'm Dr. Nedgra Abbs. I'm a wife. I'm a mother, a retired educator of 32 years. I'm a believer in Christ, in His word, in His will, and in His way. That's not part of our days here today, but that's a part of who I am. So I have to share that, with you. Speaking here with you today, one of my very recent accomplishments, which I have many, I am a graduate of the University of an Adult Child caring for an aging parent. So that's why I'm here today. Not because I have written any bestsellers. I've not published any self-help books. But if I did, I have 2 that I would start with. The first one would be Uncharted Territory. Because on my journey, when my aging parent came, it was just to move her here closer with me. And then it turned into something else. And then probably my second, which would be the last, I haven't filled in the middle just yet, but it would probably be the good, the bad, and the everlasting. Because that is a part of caring for an aging parent. On my journey, I started out and I thought, what does it mean to care for someone? Especially someone who has been the person who reared me. What does it mean to care for that person? What is my part in that? And then I looked at our topic today, connecting with care. And I came up with an acronym for CARE. For C, you have to be committed. A, you have to be accepting. R, you have to be responsible. And E, you have to be encouraging. And I want to go back and talk about the C, committed. Not just committed to taking on the job, but being committed to everything that the job brings to you. The A is the accepting. That was the part that was hard for me. Accepting the fact that my mother needed my care. You know, a vibrant woman who was always her own boss. So I had to be accepting of that. And I also had to be accepting of being committed. And then after that, the responsibility. I'm responsible for a person, and I'm also responsible for me. Because caring for your aging adult relatives, your disposition will bleed off into those people. It makes no difference what the handicapping condition is. So I had to be responsible for me, and I had to find out what is my part in being responsible to my loved one. And then the encouraging part. And I didn't learn this part until the very end. Encouraging. Not just encouraging my aging parent, I had to encourage myself. Because I will tell you, there were some days on my journey, I was invincible. I mean, I was clicking on all cylinders, doing everything right, and nobody could tell me I was doing anything wrong. And then some days in the same day, I felt like I was walking in circles. And then the days when I thought, I am not the person for this job. This job is bigger than me. I have all of the academic knowledge, but this job is bigger than me. But I didn't have the education that I needed to be a caregiver. And I wish I had these people when I got there. But thanks to God, I navigated some kind of way until I got to a place where I wasn't afraid to ask questions anymore. I wasn't afraid to say, I don't know. So that encouraging part is most important, not just for the caregiving, but it's important for you, the overseer. And then, and I have my notes here because I don't want to go over my time because I'm not the person that you really need to hear. And my thing of it is, you know, when you decide to be a caregiver, there are many different layers and there are many different configurations of being a caregiver. Sometimes when your parents or whoever is aging, you want to hire around-the-clock care. And I want to let you know that is okay. But what is your part? Some people choose assisted living, and that is okay. But as the family, what is your part? Some people choose to care for that aging relative or parent in the home. What is your part? When you decide that you are going to be caregiver on some level, either you're all in or you're not. And the all in part is the hardest part because guess what? When my mother came and we chose to care for her at our home, that involved my husband. We still had a child in college. We had to sit down and talk about what is our part now that we've decided to take on this journey. What happens to the life that we have built for our family? What does that look like? You know, how are we committed? How do we accept that? How do we encourage ourselves? What is the plan? What is the process? And are we all in or are we all out? So being here today, I am so glad that you are, because the people who are going to speak to you today are the people who can help. And I will say it again, I wish I had those people in my life when I started. But at the same time, I wouldn't do it any differently. Were there changes in my life? There are still changes in my life. And when it happened to me, I never knew what my journey was in taking on that responsibility. Because I'm the oldest of 7. So there were many others who could have taken on that responsibility. But just like I told Liesa, I felt like there was nobody who could do it better than me. not knowing the journey that I was getting ready to go on. And it is a journey because it is not a sprint, it's a marathon. And you have to be able to be ready to commit, to accept, to be responsible, and to encourage you and encourage your loved one, because guess what? There is still an adult in that body somewhere. Whether it's physical or it's mental, there is still an adult in that body. So the people here who are here today, don't be afraid to reach out for help. Don't be afraid to say, I don't know and I don't understand. It doesn't make you look like any less of a person, because any day, in your best effort and in your sincere efforts, you need some help. So please, just decide first before you even go through the CARE acronym. Am I all in? Am I all out? Or am I on the outside looking in? So, like I say, I never thought I would be talking to you about an aging parent. I educate children and adults on academic things. But I want to say, and I want to dedicate this day to my mom, because without her, I feel like the journey that I'm sharing with you is a journey that a lot of people are going to have to face. Either now you're in that place or you are anticipating being in that place. So just think, am I all in? Am I out? Or am I on the outside looking in? Thank you.
Hello, y'all. I am Tori. I am a licensed clinical social worker. My experience is actually in a hospital setting, as well as I'm currently with St. Joseph Hospice, and as well as Stat Home Health. So I get to see patients and families on all levels of care. I get to see them in different stages of life, and whether they are searching for continued therapy and to keep improving, or if they're looking for more for staying at home, if they're looking for avoiding doctor's appointments and just maintaining that comfort and dignity at the end of life. So I get to see patients and families at all different levels, and I get to talk to them about preparing for the aging process. Having these conversations with our aging loved ones, whether that's a parent, whether that's an aunt and uncle, whether that's a sibling, whether whoever that may be, right? Whoever that is, it's hard to have these conversations. It is hard to talk about what do we want in this next chapter of our life. What does this next chapter look like? What are my goals of care? And so something that I wanted to give y'all and talk about is how to start those conversations. So having those conversations early, before there is a crisis, before there is an emergency, is the ideal time. Having those conversations when we start to notice that we're going to the doctor a little bit more, that we're starting to have some changes in our health, that we're starting to get on some extra prescriptions for this, this, and this. Knowing when we're starting to have those changes in health is when to start having those conversations of our goals of care. I will share with y'all that me personally, my family, already have those conversations before we're even at that phase of our life. We are talking about, what are our goals? Do we want to have aggressive treatment? Do we want to go to the hospital? Do we not want to go to the hospital? What are our goals? And so that way, the purpose of having these conversations is to not take away the decision making from the aging loved one, but it's to know what their decisions would be. So that way we as their family and their loved ones can support them and advocate for their choices whenever they become unable to make those choices on their own, should they get to that point one day. So choosing a calm time to talk, saying, hey, we really need to sit down and just talk. And I know you've been going to the doctor a lot lately. Let's talk about how that's going. Let's talk about how, physical therapy is going. Or do we need a nurse to come in? Do we need someone to come in and help with some meals? What does that look like? Expressing your love and concerns. Letting them know that you love them. Letting them know, hey, I've noticed this change. I've noticed that we're getting a little more forgetful. Hey, I've noticed that we're looking at forgetting our medication in the morning. What can we do to help with that? What can I do to help you? That could be a pill planner. That could be something super, as a reminder or a calendar, something like that. Talking with the loved one of what your concerns are. And so asking open-ended questions. That is going to be where we are asking, hey, if something should happen, what do you want? What do you want me to know about your wishes, about your health care, about end of life, about how you choose to live, where you want to live whenever you need more help? If that's going to be moving in with me, if that's going to be moving in with brother or sister, if that's going to be moving into assisted living, whatever that looks like, if that's extra help in the home, if that is asking the doctor for home health care, for a nurse and physical therapy and occupational therapy to come and help out for a short time. If that is asking the doctor about hospice and what does that level of care look like and what can they provide. Talking about what the aging loved one's goals and desires are. And that can be a hard conversation. That can be very hard, talking about, hey, if you become unable to make your own decisions, what do you need me to know? That is a hard conversation to have no matter when it is, but it's best to have it whenever we are calm, whenever we're not in a crisis, if possible, and but before, pre-planning for any of this, okay? Listening to them. Listening and not trying to change their mind. Letting them feel heard in what they want. If they want to go through, this treatment and they want a feeding tube and they want dialysis and they want things, knowing those things, knowing their wishes. Or if their choices are, no, I don't want those, I would rather not get those things done, then knowing what those choices are. So that way, should they ever become unable to make those decisions, not be able to make those on their own, you know what they want and you can advocate for that because you are their advocate. If they become unable to advocate for themselves, you become their advocate. So some things to talk about is safety in the home. So that could be, hey, this rug, the corner of the rug is really curled up. Let's go ahead and take this rug out because I don't want, us tripping over that. That's getting equipment in the home. If we need a walker, if our balance gets unsteady, talking with the doctor about, hey, let's look into a walker, just for some extra stability for those days that you're feeling really weak, right? Looking into some community resources for getting ramps built up to the home to help getting in and out of the home easier if there's steps at the door. The medication management. If someone becomes unable to routinely and safely take their medications on time as prescribed, talking about them beforehand, how would you like to handle this in the future? Would you like for me to give you your medications? Would you like for a pill planner? Would you like someone else to come in? Would you like a caregiver to come in and help with that? Knowing what medications they're on, knowing when they have to take them, and knowing a safe way to administer those medications is going to be very helpful in managing their health, in trying to prevent a crisis. So if they have heart issues, how do we manage those heart issues with this medication? Talking to the doctors about any medication questions that y'all have, and hey, what are the risks and benefits of each of these medicines? What are some things I should be looking for? So having the conversation about medications, especially as new medications get added, talking and learning about those medications and what are some side effects. Going and talking to the doctors and asking, hey, my loved one is on this medication now. I want to make sure that I give it to them in the right way. How can I do that? Driving and transportation. So a lot of times we come to the point in our lives where our reflexes are not where they used to be. And so driving can become a safety hazard, right? Having that conversation with your aging loved one of when is that time? When is the time to start relying on others for that transportation all the time? Looking into local resources, which here in Huntsville, there are a handful of some for getting to doctor's appointments and things like that. Or if that's, hey, we have this caregiver service here in town, they can help with transportation. Let's talk with them about helping with that. How to get to the doctor's appointments, how to get to the pharmacy, or our medications delivered to the home. How do we handle that, and how do we plan and prepare for that? Social connection and isolation. Having the social support system, that emotional support, the socialization, the interaction with others is so important for every phase of our life, especially for the aging ones, okay? At that point in our life, a lot of times we have lost loved ones, we have lost friends, and our social support system gets smaller as we age. And so reminding yourself as the caregiver, as the loved one, of the need for that socialization for the aging loved one. If that is bringing them coffee, if that is taking them out to the senior center, if that's going and playing a board game with them, whatever that looks like, looking into volunteer services for that, talking to churches and seeing what they have to help just build that community and build that emotional well-being, that emotional support for the aging loved one. So, cognitive changes. Not everyone experiences the cognitive changes, right? Some people just have the physical. Some people are vice versa. Sometimes they have the cognitive changes, but not the physical, where their physical well-being and they're physically capable of going through the grocery store, but the cognitive side of it is they don't know where they're going in the store. So being aware of those memory changes, being aware of, hey, they're not knowing what day of the week it is. They're starting to forget when appointments are. Now they're starting to forget my face. Now they're starting to forget memories. Being aware that that is not who they are. That is part of a disease process. Whatever that disease process is, reminding yourself as a loved one that it is nothing that you did or did not do, okay? That is just part of some disease processes, okay? And going in hand with that, how do we adjust to these cognitive changes? Whenever someone has the memory decline, the cognitive changes where they're not able to remember things anymore, right? They're not able to make sound decisions where they would like to live and who they would like to live with. Having those conversations before those cognitive changes come into play, okay? Finances and bills, who's gonna manage money? Are we going to have a financial advisor? Are we going to have, someone listed as the medical or the financial power of attorney? Are we going to have someone on the bank account? Who's going to manage those bills? Who's going to set up the payments so that way the mortgage is paid or rent is paid, that the water bill is paid, that they have electricity? Who's going to be managing that? Are we going to set those up on auto pay? Which account are they coming out of? And who is managing to make sure that there is money in that account to pay those bills? So that way we don't have to worry about the water being shut off. So having those conversations in advance of who's going to manage this, how long am I going to be able to manage this? And when does someone else take over? Going back to where do I want to live, the long-term care. Do I want to stay at home? Do I want to live with family? Do I want to have caregivers in the home? Do I want to go into an assisted living facility or a nursing facility? And knowing the financial side behind all of that, whether that is private pay for those services or that placement, whether that is Medicaid and how do we get Medicaid and qualify for that, right? What do we need to do to prepare for that phase of life? Are we going to stay at home and someone's going to be retired and not working and they're going to be the caregiver, right? And how do we manage that? How do we manage making sure all of our needs are met? And how do we make sure we get the groceries? And how do we make sure that all the bills are paid, right? Talking about the finances, the long-term living arrangements, and the health decisions all go hand in hand. And so having those conversations early is what's important. In addition to all that, legal planning. Having conversations is the first step. A next step is getting it documented. It is not required by any means, right? The state of Texas tells us that if someone is unable to make their own decisions, the state of Texas gives us a pecking order of who makes the medical decisions if they're unable to make it themselves. But sometimes there can be disagreeing family members, right? There can be questions in who is the next of kin, right? And so having legal directives such as a power of attorney for medical or healthcare decisions, having a power of attorney for financial decisions, having a durable power of attorney that covers the estate and those kinds of things. Having those and talking with, an attorney or a legal aid about those. So that way, when the time does come that someone does have to make decisions on their behalf, we know what their decisions would be and we know who is making those decisions. Okay. At the bottom, I gave y'all some resources for the Houston-Galveston Area Agency on Aging, as well as Lone Star Legal Aid and Community Care Services. These are all just kind of some really good starting resources for, hey, I need to start having some conversations. I need to start planning. I need to start estate planning with my loved one. I need to start working on power of attorney with my loved one. I need to start having conversations about the medical healthcare decisions that they would want. And they want to get that documented. How can I do that? These resources can help with that. They can help with getting connected with Medicare, Medicaid benefits and eligibility and enrollment. They can help with getting caregiver services in the home and what options are available, whether that's private pay, whether that's if they're eligible for Medicaid, that would cover that, and getting you connected with companies that can help with those, right? Or if that's going to be through veteran services, they can help with that through VA benefits, or if that's through long-term care insurance that they've had for, so many years that they're now deciding to use. They can help, these resources can help with connecting with further resources. So, in summary, having the conversations early, having the meaningful, hard conversations early is what's important. Talking about what their wishes would be, who's going to make decisions, and how to prepare for this phase of life, right? There is no, at least I have not found, a book out there on this phase of life, right? There's books out there of how to be a parent, like Liesa was saying earlier. There's books there's trainings of how to be a parent. There's not really a lot of trainings out there of how to care for your aging loved one. And so having the conversations early, talking about what they want, talking about what is feasible and what is possible with finances, with the social support system that is present, and having those honest, heartfelt conversations is what's important. Thank you.
So look, I can imagine that everyone is thinking, this is really good information, right? What do you say? Good information? But I know that going to many conferences when I was working and now that I volunteer and have my own business, I get all this great information and I think, man, I'm gonna do something, I'm hyped. But once you get back into the real world, what do? You really kind of forget about it, or, if you've gotten a bunch of handouts, you just put them aside because you just can't realize it because you're back to life and you can't. So that is why we're intending to do this monthly. That is why we're having people who are right here in our area who can constantly help us, constantly give us information. You have someone that you can actually see face to face and not call somebody and get a recording and 30 minutes later you might get a live person. But this is why we want to do this. In addition to that, what I said earlier is we want to make sure you're not alone for those of you who are on this journey, because I believe there's an opportunity for a networking agency, because, if you don't know how to do something or you get overwhelmed, maybe you can reach out to someone you saw at a workshop to say, hey, look, this is what I'm dealing with. What do you think? How can you help? You can also do this because we have these people right here available. Somebody who's actually gone through it. And I would say, because I saw part of the journey go through it successfully, very lovingly. And I know there were days that was hard, but went through it. So those are the kind of things. One thing I want to add, because Tori brought it up, I was going to wait to the end, but I'm going to go ahead. Something else that I'm really passionate about is life planning. Too many of us don't like to talk about our final wishes when we go, but it's not if it's going to happen, we are going to pass. And why not make your decisions of doing it? There are two reasons. I want my son to do what I want him to do when I'm gone. That's exactly, not that I'm so controlling, but that's just and I want him to be able to grieve and not have to try to figure out or not have to deal with people trying to get over on him. I want him to go through it. So I found something that I think is so wonderful that I've given out to so many people. It's actually from, and I always hate saying this because people get a little weary of this, but it's from Funeral Director's Life. And what they have put together is this little guide. And I'm going to read what it says. It's Thoughtful Decisions Guide. And it says, Dear loved ones, I prepared this guide for you and those I care about. Inside, you will find a brief overview of my life, a listing of those most dear to me, and some of my most precious memories. For your peace of mind, as well as my own, I have included my wishes for my funeral service, along with other vital information you will need at the time of my death. I completed this guide with much love and foresight. My desire is to lessen the burdens you will have at my time of passing so that you can celebrate our life together. So I just think Funeral Director's Life really put this together. It's not overwhelming. It's simple. You can fill it out. So I want to make sure that you all have one of these to take with you, and you can make more copies. I can get you more, but these I think are so needed. So we're going to go ahead and get started with Ali and Alta. So they have some amazing information. And I just want to say before they start, those two have helped me out so many ways. I could tell you this really long story about one of our veterans that was near and dear to my heart that we consistently tried, and thank goodness these two were able to come in and really do some great work to help me with him. He's passed on now, but they were very instrumental in helping him get everything that he needed for his safety. So,
all right. Good morning, everyone. Thank you for being here. I think it's really important for everyone to be here to learn a lot about just the care process in general and your journey. I think first and foremost, it is a journey. It is a process. It is something that you cannot just embark on without proper guidance, without someone to kind of guide you through it. And a lot of what I'm going to touch upon is going to be probably piggybacking off of Tori. As she was talking, I was like, man, those were some of my pointers. But I'll just kind of go more in depth into a lot of what she touched upon. But before I start, I want to kind of the Webster Dictionary for a caregiver is person who provides direct care as for children, elderly people, or the chronically ill. That is how Webster describes what a caregiver role is, right? Now, that caregiver role is what Webster describes. Your caregiving role is going to evolve, right? It's going to be more than just providing care. You're going to be their support. You're going to be their companion. You're going to be their day-to-day person that they rely on. And that takes me into my next one, which is by this lady called Tia Walker. She has written a book on caregiving. It's called Inspired Caregiving. She said, to care for those who once cared for us is one of the highest honors. And I think that's a really important thing. And we often forget why we're providing care, especially when it comes to our parents. And now just to kind of take you back into our journey as to why we started this business, Alta and I kind of want her to come up here, but I know she has to hand out material. But why we started this business, Alta cared for her mom when she had cancer. And she was her full-time caregiver. Are you in tears? We get emotional about things like this, but she was her full-time caregiver, and if she wasn't there, her sister was there. So they were kind of rotating around the clock, providing that 24-hour care, which is why when I moved to Texas back in 2017, she was not able to move with me. She had to be in New York caring for her mom until she was better about 4 years later. I lost my dad last year in September, and that really hit me hard. And I think part of that reason was I was the only one that knew what was going on with my dad. And I was the only one trying to really direct my sisters on what to do. And they didn't have a first clue of what was going on. They didn't know what a social worker was. They didn't know what caregivers were. My sister lived with my dad full time, but she did not have the full resources that she needed. And now she is the primary person that is grieving because of that loss. When I went to see my dad, I arranged caregiving services for him. I took every step possible to make sure that he was comfortable through his, what I call the last stage of his journey, and a lot of the things that we as children don't think about come to light during those transitions, right? And as you embark on your journey as a caregiver, or I don't know how many of you are actually caregivers. So what I'm going to have everyone do right now is I have this notepad in front of you for a reason. I'm going to have you guys write down the first name of the person that you will either be providing care for in the future or you have provided care for in the past. And then I would like you to fold that paper and set it aside. That's what we're going to do. And then right underneath that name that you write, I would like for you guys to write down, why are you here? Give us some real big thought about why are you here? What is your purpose? What is the meaning behind the reason why you're here? So in our business here, if you walk onto the other side of our hallway here, you will see core values, and they're there for a reason. That is what Alta and I firmly believe in. And those values are what we teach our caregivers. and I'm going to read them to you. Dignity matters. Be present and engaged. Care like family. Have fun. And serve passionately. Those are our core values. Why they're important? If you look at every one of those, it has a meaning behind it. Every elder, does not matter even if you're an elder, you need to be treated with dignity. Especially when you're an elder, you have lost most of your independence. The only thing you have left is your dignity. And the person taking care of that person should treat them like family, treat them with respect, and treat them with passion. And have fun with that person that you're caring for. Especially when it comes to dementia. Dementia is one of those things where you need every one of those values. And that have fun is probably one of the most important ones. That is probably the last thing to go with dementia. There's a reason why they say music is so important with someone with dementia, because that brings back great memories. And it does not matter who you are, you will always remember the fun times that you had, right? So what is home care, right? As you start your journey, you're either going to be a family caregiver, or like Tori mentioned, as you're developing your resources, you might be looking for an outside resource. That might be an agency, right? So what is home care? Home care is when a business like ours connects with the family, understands their needs of care, understands the client themselves, the family member, truly gets to know them, who they are as a person. And that is what Alta and I do. We sit down with the family, and it does not matter how long it takes. It could take hours, it could take an hour, it could take half an hour. We want to know everything about the family. We want to know everything about that person that we will be providing care for, because that truly helps us as to who we are going to assign to that person as a caregiver. Outside of that, Alta, can you hand out the 50 ways we can help? A lot of times people call us, and the first question they ask us is, what can you guys do for us? Because they don't know. Tori mentioned hospice. She mentioned home health, right? That is skilled medical services. PTOT, speech, in-home visits where they can, monitor the PIC lines. Those are all medical needs, right? Post-discharge from hospital or coming home from rehab, those are the things that home health would do. Home care is a little bit different. That is more long-term care that hospice nor home health would be able to provide, right? We can come in. Now, hospice can do bats, right? We can come in, we can do the bats. We talked about transportation, right? We can provide the transportation. We can run errands. We can do the groceries, right? All of those things we can do. We can build the activities into the care plans based on, again, our initial conversations with the family. What does that person like to do? What do they used to like to do that they no longer are able to do? What are their goals? What are the family goals, and what is the individual goal? Do they want to increase walking? Do they want to get active more? Do they want to be more engaged? Those are the goals that we set in place, right? For example, did mom like crocheting that she no longer likes to do because dementia took over, and she no longer has a desire, nor does she have the willpower to do? So do we need to assign a caregiver that can do those things with mom and dad, right? Outside of that, this is really, when you're looking at planning, right? This is a great tool to look at and go, it's actually, we built this as if like it's an activity with a parent, right? If you see that next to it, there's like circles, right? You can sit down with mom and dad and go, Mom, would you like medication reminders? Or Mom, would you like to play games and cards? We have clients that do this all the time, and they let us know, hey, the 50 ways card that you provided, Mom checked off X, Y, and Z, and that's what she would like to do, and it's really helpful, right? So that's what home care really is. And while you're pursuing home care, can you hand out the questions to ask? It is really, really important that you choose the right company. You're doing your research. I always say this, trust but verify. Those are some of the questions that I always provide our families to think about, to not just think about, but ask when you're doing your research. Ask if the company providing care is licensed and fully bonded by the state of Texas. You do not want someone that's not licensed with no oversight through the state, nor do you want anyone that's not fully bonded. What will happen if you have someone in the home and mom falls and the caregiver is trying to catch them and they fall with them and now they're hurt? What can happen? Now that caregiver goes to court and sues mom. Does mom need that kind of headache? I don't think so. Right? So ensuring that someone is bonded, for example, us, we have workers' compensation, we have general insurance liability, we have auto liability if they're driving mom or dad. We have cyber insurance, also making sure that we're protecting their digital data to avoid any type of data breaches. And if it does happen, what's going to happen? That's going to cover all the ransomware, right? So doing your due diligence when you're seeking care, it's not as simple as calling an agency, do you guys assist with this? And they say yes. Okay, when can you send caregivers? No. Ask these questions. Are they doing national background checks? How many of you have seen in the news elders being exploited or mistreated? Why is that happening? Companies are not doing their due diligence. They're not checking their backgrounds, right? They're not doing in-person interviews. Asking questions. Do you do in-person interviews? A lot of times the companies will outsource interviews to third-party vendors. Why? Because it's easier for someone else to do it. They will never see that caregiver. They have never probably seen them ever. They know their name. They know which client they go to, but they have never seen or laid their eyes on them. What does that tell you? What does that tell you? Making sure they do in-person interviews. Why is that important? I could give you an example. Why is that important? Every time a caregiver walks in my office, I want to see what they look like. Their appearance tells me everything. Missing teeth, what does that tell me? Something is wrong. If they come in here in pajamas for an interview, is that someone I want to send to a family? No. So trust but verify. Making sure they're doing drug testing. Elders always have medication in the home. And not just any kind of medication. They have controlled substances, narcotics. She can attest to that. So making sure you have the right caregivers that have been drug tested. How are they training their employees? Are they just giving them instructions on the phone? Or are they actually training their caregivers? Right? Are they matching their clients with the right caregiver? Requesting those meet and greets. Can mom meet the caregiver before they start care? We do it all the time because that makes the client feel so much more comfortable. Now remember, this is their home that someone is coming into. This is not someone else's home. This is mom and dad's home. You've got a stranger walking into your house. So the meet and greet is, in my opinion, really important. It doesn't really cost the agency much. We send them for half an hour. They get to meet the person that's going to providing care for them. They can ask them all the questions they want. It's a second or third interview at that point that the family is now able to do, and they feel like they're part of the process, right? And we already discussed the compensation part there. I'm also going to pass out the 12 dementia-wise tools. These are really important. All of our caregivers have these on the back of their badges. All of them do. We have it minimized. And when they run into situations where they're not able to respond to a certain type of situation, they can look at the back of their card and go, all right, I need to check myself. I need to make a meaningful connection. Or do I need to use effective two-way communication? What else we got here? Show respect, listen, affirm feelings, and redirect. Enter the loved one's reality. Know what they're going through, right? Remember the power of presence. Provide stimulation. Biggest thing with dementia patients is to wear them out. How do you do that? Brain activities. Anything to do with the brain. Puzzles. Crossword puzzles. Crocheting. Anything that allows them to utilize their brain. I will guarantee you that they will be tired. Think outside the box. Don't just think about what's happening in the moment. Think about, okay, what else can I do? Walk away, right? That's the easiest thing to do with a dementia patient. If they're on edge and they're getting combative, walk away. Give them a moment and then come back and redirect. Provide meaningful activities. Consider the environment that they're in, right? Is the lighting too bright? Or is there not enough lighting? With dementia patients, you've got to have as much lighting as you could possibly can. Because as the brain starts to deteriorate, they start to lose some of that lighting aspect of it. Put your loved one on the team. Make them part of the process. Make them part of the care process. Ask them questions. Allow them to decide. Would you like this water or would you like this? Easiest decision for them to make. Don't go, would you like this, 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 and this? Too many choices, right? So be as simple and direct as possible.
Putting down your observations is a great tool to provide to your specialist, to the specialist that's caring for that loved one, because you are not going to remember in the moment what they're going through. So make sure you make lists. Pay attention to what they're doing every day. Are they combative? Are their moods changing a certain time of the day, like sundowners? Are they losing some abilities? Is mobility an issue now? Make sure you jot down those observations and bring that to the specialist, so you don't forget, because you'll be so overwhelmed with the day-to-day that you're not going to remember what happened yesterday. So always over document, I say. We've had clients where they have notebooks. This happened on this day. They walked out of the house. They wandered. You can bring that all to the specialist and go, this is what's happening. What can we do? That's your biggest tool. It's documentation and all your observations.
What are some of the pay sources? How do you pay for this, right? A lot of agencies, they have their minimums per week. They might have minimums per shift. They might have minimum per day. It just depends on an individual agency. Ask them these questions. Do you have a weekly minimum? Or do you have a per shift minimum? Because a lot of agencies that we've come across have weekly minimum versus daily minimums, right? So those questions are really important because it impacts the overall cost of care. Every agency is going to charge you by the hour. Now, if they have a weekly minimum, versus a daily minimum, that cost is going to multiply by 5 or 6 or even 7, right? So you've also got to identify the needs of care based on, do they do nurse assessments, right? Those are really important. Do the nurse assessments? Are the owners involved? Half the time you're not going to find the owners. That's just the reality of things, right? How much involvement is there from the staff? Do they have a transition period from the time that they're admitted into the agency where they provide you X amount of days of support, right? Or does that go away? First of all, that should never go away, but those are some of the questions to ask. What is your support within this process? Now, there was a survey done from Genworth for the cost of care. So according to the survey, an average cost for assisted living was $4,500 per month, and this was as of 2021. And I'm sure with inflation, it's a lot higher now. Okay. Nursing home with a semi-private room was about $8,000 per month. Okay, so these are all factors to consider when you're looking at, do I put mom in an assisted living? Do I put them in a nursing home in a semi-private room? Or do I go and get a home care agency that can provide maybe 20 to 25 hours per week in the home at a cost that's about 75% lower, right? Those are all factors to consider. Now, in a facility, it also depends on the need of care, right? If they need around the clock 24/7 care, being in the home with a caregiver for 20 hours per week is not going to be ideal. That's a really bad experience for the patient as well as the caregiver. It's just not fair to either one of them, right? And that's when you really consider the facility. Now, if the care need is minimal and it can be completed within those 20 hours, or can be supplemented with either a loved one also providing care, so that they're using maybe 20 hours or 16 hours or whatever that might be, with taking that as respite time, right? It's doable. So thinking through every scenario of, where is mom and dad in their current state, and where will they be in a month or two from now, and what are my options, right? And planning for those things, as Tori was saying initially, with having a power of attorney, knowing what your financials are looking like, right? All those things should already be kind of set in place. And Alta and I, we experience this all the time, where we go into the home, we are doing an admission, and we ask, is there a DNR in place? And there is not. So we can't make that decision for the family. We just cannot, right? And that's where the family has to let us know what that wish is going to be. Or we walk into a home and the son is trying to sign the documents, and we say, do you have a power of attorney? No. Well, obviously you can't sign these documents. You don't have a power of attorney to sign over mom's financials, right? So there's a lot of factors involved, and that go back to what Tori was saying. And by the way, Tori's great. We work with them all the time. So I know exactly where she's coming from when she's talking about these things. We experience it on a daily basis. So when she says plan for it, and I say plan for it, please plan for it. We're not lying to you. Can you pass out the pay sources? Oh, you're already there. Okay, so for the pay sources, I don't want to talk through all of them, right? So you have the self-funded option, which has no restriction of number of hours, right? Again, we have a 4-hour minimum, but other agencies might have 20 hours per week minimum. It just depends on which agency you're going with. Free home visits prior to providing a billing rate. So we usually don't provide a billing rate until we meet with the family and review the needs of care. We can give you a kind of like a ballpark of what that be on the phone, but until we see what the care needs are, because the family will always tell you it's not that bad. But until we see for ourselves, or our nurse goes and sees what the actual care needs are, then we really know what the level of care is going to be, because it truly makes an impact on the back end when we're looking at the liability increasing. We're looking at the type of caregiver that's going to be going, and we're also projecting a lot of turnover. With the turnover, then we have to hire more people, and it just increases a lot of recruiting costs, as well as, do we need licensed people, or can we staff with very experienced caregivers? That makes a true difference. If I've got a staff with, like, let's say a CNA who's certified, that increases our cost, right? Because now they want more hourly rate per hour, and it just makes a whole lot of difference. And then we work with the VA directly. We're contracted with the VA. So do you also want to ask other agencies, if there is a veteran in place, are you contracted with the VA, right? A lot of them will tell you they are, but trust but verify. You can always go onto the VA website, type in the zip code, and it will show you all the community care partners. The reason why I say that is because I've seen this time and time again, where they say they work with the VA, and then I look at that website and they don't. And the reason why they say they work with the VA is because there's another source of pay, which is aid in attendance. Aid in attendance, you do not have to have a contract with the VA. However, it's a VA-funded program, so that agency can actually say they work with the VA when they do not. So again, trust but verify, right? There's two separate VA systems. Aid in attendance is a VA-funded program for long-term care that can be used for facilities as well as paying agencies for care. And then there's a VA contract that you're directly contracted with the VA that can provide that long-term care, and they pay directly, and the veteran never sees a bill for it. And I mentioned that they're on the aid in attendance. Now there is the guide program, which is amazing, by the way. It's a brand new program that Medicare has finally realized that people caring for someone with dementia need help. So they've launched an 8-year pilot program. What GUIDE stands for is Guiding an Improved Dementia Experience. And it's very specifically for family caregivers. What it entails is it's a 24-hour support system program, as long as they have middle to severe dementia and it's diagnosed. Actually, they don't even have to have a diagnosis. Now the diagnosis can be made through an assessment that we can do. What it entails is access to 24-hour social workers. It entails access to education resources directly through the Alzheimer's Association. It also includes a very small portion of respite of $2,500 per year that can be used towards getting caregivers in the home. And it's not 2,500, I'm sorry, they just increased it to 2,663. Makes a huge difference. But they were very proud of the fact that they increased the budget. Okay. But it does make an impact. And they have very strict guidelines around this program, where the shift has to be at least 4 hours. It cannot be anything less. It can't be anything more. So it can't be a 5-hour shift. It can be an 8-hour shift, or it could be a 12-hour shift, but it cannot be 7 or 9, right? So no going over the 4 or the 8 or the 12 or 24 hours, whatever that might be. That number actually sums out to be about 72 hours per year for the family to use, and it runs from July to July. And what that does is it resets every July. So you're starting back at $2,600 every year. And families are really appreciating it. We have quite a few families on that program right now. And just for them to call us and say, hey, I'm overwhelmed. I need a caregiver this Friday, just so my husband and I can go have dinner together. They're that overwhelmed. And we'll say, yes, we can provide someone. And they'll go out and they'll stay with mom and dad, and while they go out and just enjoy some them time. So that really helps. Even though it doesn't seem like a lot of money, it's some rest. And those that have probably taken care of someone with dementia, you can probably attest to the fact that 72 hours per year probably feels like a lifetime, right? Yes, so they cannot be on hospice. They cannot be in a living facility. They have to have traditional Medicare. They cannot have Medicare Advantage. So there's a lot of limitations to that program. So they have to have strictly Medicare A and B as their primary. Now they can have Medicare Advantage, but it cannot be their primary. Their primary has to be Medicare traditional. And they cannot be in a living facility or hospice. Was there anything else to that? Okay. And then there's the helper bees, which which is an interesting one because they do help with Medicare Advantage plans. Let's first talk about the Medicare Advantage plans. A lot of Medicare Advantage plans will not cover in-home care. Now, there's some that will. For example, if you have Aetna, right? Within Aetna, there's about 1,000 plans, right? Or if you have United Health, go ahead. 5 minutes? I'm on the clock. Or if you have UHC, I mean, there's so many plans under UHC. So you have to be very careful when you're selecting a plan to ensure that it has very specifically indicated that it includes in-home care. Otherwise, it would not cover it. Now, these Medicare Advantage plans are good when you're coming out of rehab. They can then provide those hours for in-home care just because it saves them money long term, right? The longer they can keep you out of the hospital, the more money they make.
Carriers that we can get these services through. So one of them is Aetna, and you have to have had you would have to have been released from rehab in order to qualify for in-home care. And it's a process. You have to call the insurance, see if the plan has in-home care. There's a referral process, but we're contracted through these plans. But there are so many plans; it's unbelievable. So you kind of have to go through the carrier and see if your particular plan does have that coverage. And there's a difference, like he said at the beginning. There's a difference between home health, which almost every single plan has home health, but in-home care is there's very slim amount of plans that do have that coverage.
And then the common thing is long-term care insurance. So if someone has long-term care insurance, I always like to tell families double check, because a lot of times mom and dad bought it in the 50s or the 60s and they forgot all about it. So go through their paperwork as you're planning to make sure you're digging up old paperwork. And oftentimes we've had families and their daughters found some type of policy. And I think we've had 2 cases like that where they went through paperwork and they found out that mom had long-term care insurance that she bought like in the 70s, and she forgot all about it. And it actually helped because it ended up paying for her care. So, double check to make sure your parents may or may not have a policy. With that, I think that it's also important to note that every long-term care insurance has an elimination period. So always verify what that is. And if it's 30 days or 60 days, they will have to pay out of pocket for those 60 days to meet that elimination period. And then the long-term care starts to pay. But there are certain things like home health or rehabs that can count towards long-term care elimination period. So we always tell families to jot down the dates that mom and dad have either been into rehab or have had home health, because those will count towards the elimination period. But it's also based on the insurance that they have and whether they accept it or not. But for sure, rehab does count. The last thing I will leave you guys with is the simple act of caring is heroic. I know everyone in this room has been at some point a caregiver. Maybe not you yet, but you will be in the future. She will make sure of it.
She has been, and he was the absolute best.
No, it really is an act of heroics, right? So Alta, did you want to say anything before I turn it over to Liesa for allowing me to have all this time?
We've provided you some resources that you can take with you to kind of guide you in a direction. I wouldn't say the right direction because everyone has a very different situation. But just reach out to your community. There's a lot of resources, especially here in Huntsville, that can really assist you. Pick up the phone. And I've come across here in this community that you just pick up a phone, call someone, they'll help you. They'll find someone that can help you. So just take advantage of that as well.
Yeah. I mean, we get calls daily and we're like, okay, we know this person is calling because they are panicking, right? So what do? We go down the list of every pay of sources that could be available to them to avoid them paying out of pocket, right? So we'll reach out to other companies, we'll reach out to other sources to find as much as we possibly can for that person. So don't feel like you're out there on an island by yourself. You're not. There are people here that can help you. Okay.
How about this?
Any other
Like
questions?
the information that you're getting, especially from these guys, how important is it? So what I'd like to say is I'm so grateful that they cared enough to give their time at no cost. It's like when I do the veteran breakfast. This is not free. This is just at no cost because we're getting a lot of education and knowledge from these people. And besides, thank you so much for letting us use this facility because there's no cost for that either. So this information is so great, and it's just such a blessing that they see the vision and want to just give back and want to help with the knowledge that they have. So how about it? Can I please ask for a hand? I know we're not in church, but I'm telling you, this is so important. I'm so grateful. Our next workshop will be August the 29th, so look for the information. Tell people about it and make sure that the people know about this because I know you know people who need this information. And again, the information there's a whole plethora of, attorneys and financial people who will be coming in and talking. So there's a lot of different information that will be coming in different waves. So make sure you tell them. I do want to say I have a feedback form. It's only going to take you about 3 minutes to fill it out. If you don't mind, please, please, please fill it out. Just let us know what you think because the only way we can know what you're thinking is if you tell us. The only way we can make it better is if we know what you think could have been done better or what was not done good. Okay? So if you would. But I do want to end by closing it out with Dr. Abbs. If she would come up and just please final us out. She wasn't expecting it, so I ain't looking at her. I'm keep my head down. And I do want to say thank you to my daughter-in-law and my son for coming, providing help. I tell you, it takes a village. You know, they say it takes a village to raise a child, but it also takes a village when you're doing something without a lot of funding and resources. So thank them as well. Dr. Abbs?
I guess I really just want to say, here again, I said, if I had the authority to make you citizens of Walker County up in here, I would. Because the topics that went on here today, they're not easy conversations to have, but they're very, very necessary. And as I say this in my personal journey, I wish I would have had these people, in my corner. But what it does for me personally, it lets me know that in my next season, because there will be a next season, either that will be my season or somebody that I love in their season, that I don't have to navigate the waters all by myself. If nothing else from today, know that you have information, not just for your loved ones, but for you. You might be the person to open the doors for the conversation for your family, because it has to start somewhere. Our families, we don't like to talk about aging. We don't like to talk about end of life saving activities. And we definitely don't like to talk about death. But guess what? So you live, so will you die. So if you're like me, I want to be prepared. Not only just spiritually, but I want people to do what I want them to do. And if it comes my time when my family are trying to make good on my wishes and my decisions. That is a burden that I would not want to put on my family. And hopefully the information that you got here today is that door that you have opened to say, hey, follow me to this next meeting on August the 29th. This is the information we've already gotten. There is more to come to make navigating life in the next season a little bit more easy. Because life is not easy by any means. And to let people know there are many different situations on how we handle aging and end of life. It is real. It is something that we will all get there. We will all be caregivers of something or someone. Someone will be a caregiver of us, we hope. So it's a 2-phase journey. And that's exactly what it is. It is a journey. Because one day you're here and the next day you could be dead. But to all of the presenters today, I just have to say thank you again. Because I came here to share my personal story and I'm taking away information that's going to cause some roundtables at my house. So hopefully, and the same thing will happen to you. And for you, Liesa, thank you for always trying to put aging people, at the forefront, because sometimes we forget about our aging people. But until you are in that situation, and I will just speak for mine, I didn't get the opportunity to prepare. I was thrust into being a caregiver. And as I will always say, I will never have it any other way. But with the information we have today and my newfound best friends, I feel equipped to do any job that I need to do with my aging self or my aging loved one. So thank you so much.
Thank you. So one of the things that I have, I'm an old folk baby. My parents were very timely. I'm such a timely person. People think I went to the military and they changed me to be this way. No, I was this way. That's why I went to the military, I think. I don't know. And I tried to help change some of them. But thank you all so much. And I hope you'll tell somebody. Hope we'll see you back next month. And we can keep providing this information to make this world a better place, because this is what's needed. Thank you.
The myths are, Dr. Abbs, in caregiving, some.
I guess the first myth, it's not going to be as bad as I think it is. Mm-hmm. And I can do this by myself. Mm-hmm. And I think those are big myths. And I say that because I used to be a part of that myth. Yeah. Not to the fact of just, being arrogant and not wanting to do it, but caring for a woman who was very, very self-sufficient, raised me to be that way. And to whatever situation you go into, you're in it for the long haul. But the part that was missing is recognizing when you have come to the tow line of information that you know and that you need to seek help.
Good. So also I would think, like, what is the greatest challenge in going into this? I think one of the things you may not actually, sometimes you may not feel like this is where you're going, but you're going anyway. But the greatest challenge of once you're in there.
Commitment and acceptance. I cannot tell you how much commitment is the first thing that has to happen. And it's not just committing to be the caregiver. It is committing to take a step back and look at your life. Take stock of where you are. And there's a change getting ready to come. How committed am I to doing that? Because the commitment to your loved ones, I think that's a growing process. But commitment to yourself, that either, like I say, I'm all in for this. And then accepting that person who was so vital. I mean, be it a mental challenge, a physical challenge, whatever it might be. That's the hard part, is accepting what has happened, what is happening, and being able to say, I'm going to be okay with this, but I need help. So I would say, out of the whole care thing and the little acronym that I did, I just sat there and I thought, what did it mean to me? What did it mean to me to have to care for a loved one? And what y'all don't know, my mom and my dad went down sick at the same time. My mom and my dad. And my sister had to take care of my dad, and I took care of my mom. And I just had to look, what did it mean for me? It was never a question of, am I going to do this? And I didn't know that I needed to ask, how do I do this? I thought I had it all figured out. I really, really did, of how I'm going to do this. And that wasn't, I mean, I think I did a good job. I think I did a good job, but I think that my sanity would have been a little bit better had I had the resources that I've learned in the past couple of days, that I didn't have to do it by myself. And the questions that I didn't know to ask these questions until my mom was admitted to the hospital. And we had to decide what we were going to do when we knew she wasn't going to come back. When I was with my mom, I was also dealing with my husband who had major back surgery. So I had two people. And I never wanted to put my mom into a facility. And I asked for a social worker at the hospital. First time I'd ever asked for help. But I asked for help because my back was against the wall. When that lady came into our lives, so much clarity was given there. She gave me an opportunity to say, you know what, there's more than one way to care for your mother. You have gone the green mile of in-home care. Let's go ahead and put her in hospice. You know, and we know it could go either way, but let's just do hospice. So at that point, I was able to get a friend to come stay with my husband during the day while he was down. And then I could go every day to see my mom.
I like that because clarity gave you some peace and calm and just a clearer mind to think about moving forward. So that's what we're hoping that this can help people in their journey.
Well, piggying back on what you said initially, you get to the point as a caregiver where you are so overwhelmed and exhausted at times that you don't know where to turn. It's like if you don't have the information in front of you and you don't pre-plan, that's when it really hits you like, oh my God, I don't know how long I can really do this, because you do not know how exhausting and how much work it'll actually be for you to be a caregiver. You don't foresee that. And you actually have to be supportive of the person that you're caring for, because they're going through their emotional things and they feel like they're giving up, and you have to also emotionally see them in that condition. And they're your parents sometimes and you're like, oh my God, I've never seen this person cry, and they're putting this in my hands and you're trying to be there for them. So it's mentally and physically exhausting, and we hope that the information that we're providing is helpful to them to plan.
Because you don't know what you don't know.
Exactly. And you're not gonna know until you're in it, to be honest.
And just to add to that, I mean, caregiver burnout is a real thing.
Yes, it is.
Right. And you
I have
can't,
people telling me that all the time.
you cannot take care of your loved ones if you're burnt out. You can't think clearly if you're physically exhausted. So you cannot provide the level of care that they actually need. So you need to seek resources to be able to take some time off, time away to reset, rebalance, and then come back and start over again. So that they feel loved. When they feel your positive energy, they will react to that positive energy. If they feel that you're stressed out, you also have to think about that oftentimes these are going to be your parents, right? Your parents don't want to see you in a state of distress.
No.
That's why they always say, I'm fine, I'm fine, I'm fine. Because they don't want
Man, that's a
you
good point.
to take care of you.
Yes.
While you're
that's
caring for
big.
them, they're trying to take care of you because that's
in
all they
their own
know.
way, at where
That's
they
all
at
they
the
know.
level
It is, I mean, those parenting skills,
That's good.
you know, even though that person might not be the whole person, but those parenting skills never go away.
They're still there.
I told Liesa one time, the best advice I got when I first started the journey I met a friend at Ross store and she knew that I had started and she looked at me and said, don't forget to take care of you. I had no idea what that meant. See, because I had no one like this to explain to me, remember to take care of you. I'm like, I have time for me. I got other people, who need, but it's true. You have to be whole in order to be wholesome for someone else.
She said that to me quite a bit too, and so other people would just say it. I'm taking care of myself because, but there's huge, but so.
And oftentimes I think caregivers forget about that because they're so
When do you have
immersed.
time to think about it?
You don't, and they're so immersed into the care process that they forget.
Yes.
They forget, and it's very easy to forget.
Yeah, you can't only survive on food and sleep.
No.
That's it.
No, you cannot. You cannot.
You need a lot more than that.